The World Health Organization has recommended the widespread use of a malaria vaccine. This is considered a breakthrough in the fight against the disease, which kills approximately 440,000 people every year. 90% of those deaths are in Africa. Let's talk about this then in more detail and speak to the South African Health Products Regulatory Authority's chairperson, Professor Helen Rees. Prof, a very good afternoon. Always good to speak to you. So is it too soon to say that we are now officially at the early stages of malaria eradication?
Yes, I think it's too soon to say that. I think, unfortunately, we're still quite a long way away from that. But this is a huge step forward. We've been looking for a vaccine for many years. In the meantime, we've got very effective measures like bed nets that have really reduced malaria deaths and cases significantly. But in this region, where malaria is the worst, we've sort of plateaued in terms of the numbers. And so we've got stuck with the tools that we've got. So we really needed a vaccine. So this is going to be a huge breakthrough. Even though it's not the perfect vaccine, it's going to make a big difference.
And you say it's not the perfect vaccine because it does not meet the general, I don't know if it really is general, but we were talking, for example, with the COVID vaccines about an efficacy threshold of about 50% to be considered quite successful. This vaccine for malaria is around 39–40%. How should we not be discouraged by that?
No, we shouldn't, because that percentage, given the number of deaths, 260,000 deaths amongst children in this region every year, that percentage represents lots and lots of young lives saved. But in addition, when they combine that vaccine with what's called seasonal chemopreventive measures, that's drugs that seasonally are used to prevent malaria, when they combine the vaccine with that, with all the other measures, there was a reduction of 70%. That's a huge number of lives saved.
Mm-hmm. And in terms of administering the vaccine, some have said that that's another issue that is going to require a lot of consideration against to Gavi, which you are part of, the Vaccine Alliance, because this is not going to be a single shot where kids, for example, come in, they get that single shot, and off they go, and they've got this protection, correct?
Quite correct. And in fact, we first saw some of the data from the early clinical trials back in 2015. But we didn't recommend, this is on a committee of WHO that I serve on, we didn't recommend then that it was rolled out. We actually said, let's pilot it precisely because of what you're saying. It's a 4-dose vaccine. It has to be given to young children as part of their routine immunization. So we were worried whether it was going to be feasible, whether we were going to interrupt the administration of other vaccines at the same time, whether it was going to be affordable. And then when you rolled it out in the real world, would it be effective? Would it do anything? And that study has been done in 3 countries in the region with 800,000 doses administered, at least 1 dose to children. And this is where this data has come from. So we have shown that this can be integrated into vaccine programs with good effect. So those questions have been asked to some extent.
And you touched on it slightly, Prof. We're not at a point now where this can be rolled out. Gavi, which you are part of, then now needs to follow certain processes. What are they, and how soon can we get these vaccines into the arms of people, especially in Africa?
Yeah, so people who are not familiar with Gavi, it's a global alliance. It has a lot of money from rich donor countries, philanthropic organizations, and it's a major funder of the countries who are less well-resourced for their vaccination programs. It buys vaccines, it subsidizes vaccine programs, and assists with the rollout of vaccines in many countries and saves millions of lives a year, particularly from children. So that's what Gavi does. So what will happen now is that we will look scientifically at the data that WHO will be presenting to us, and then we will present that data to the board. I'm on the board, as you mentioned, as well. And then the board will decide whether to fund this or not. But the Gavi's philosophy and its vision is to reduce deaths and to get vaccines to the poorest countries of the world to reduce deaths significantly. So this certainly would fit in with Gavi's vision. The real challenge will be, given there are so many pressures on donor funds at the moment, including for other vaccinations, will we be able to raise as much money as we would hope?
And this vaccine, of course, Prof, is hailed as a great benefit, a lifesaver, as you were saying, for thousands, millions of children, really, especially in Africa. But are we possibly going into an area where, for example, if one travels from South Africa into another high malaria zone, one would be required to take such a shot?
Not yet, but there are other vaccines in development. I think everyone's familiar who's traveled with the requirement for yellow fever amongst adults who are traveling into yellow fever endemic areas in our region. So that does happen with other vaccines. But this vaccine was designed for children. Most of the deaths and the severe disease we see are still in children. So that's why we targeted children. But there are other vaccines in development, a few years away yet, which will be targeting exactly that kind of group, people who are travelers and going into endemic areas.
And we're zigzagging a bit, Professor Rees, between the issues. I'd like to go back to the issue of money. A few years, I think 2 years ago, there was some concern among researchers that money had stopped pouring into malaria research. Are you still seeing the same level of generosity as far as funders who want to look into other vaccine, other treatments for malaria?
Well, in fact, the money did come forward for this large pilot study in 3 countries that's given us these results. So that's very encouraging. So money has come forward for malaria. But I think generally it is a concern that there are many diseases still in our continent in particular that are what we call neglected. That they're there, they cause outbreaks, they cause deaths, but we're not putting very much money into research for vaccines. But there are other common diseases that we've kind of got acclimatized to that really need more investment, and I would include TB in that. And we still need to continue to invest big time into HIV in our settings. So money will continue to be something that in our region for these many infectious diseases that we will have to lobby for.
Professor Helen Rees, good to speak to you. Thank you so much for your time on this Friday afternoon.
Pleasure. Thank you.